This conference will now be recorded.
Excellent. Good afternoon, everyone. It is 12 o'clock. We are going to start right now. Thank you so much for joining us. Shannon, as discussed, there may be some people that will be joining us after the 12 o'clock time. For those who do not know me, I'm Jana Borland. I'm the Association Director for the National Native American Human Resources Association. And for those of you joining us for the first time, Nahara is a tribal led nonprofit organization focused on the HR profession and tribal leadership. And we are now in our 27th year of existence, and we are continuing to advance and advocate for Native American tribes. Today, we proudly present Shannon Rozell from Newport Health. Shannon brings a wealth of well-rounded variety of experience from her years in the workforce. When Shannon realized her own personal recovery from trauma and addiction, she had decided to complete her education and has earned a master's in public administration and moved boldly into the field of mental health. As a special project, Shannon worked collaboratively with the police, high school, and a youth assistance program to create an 8-week court diversion program for teens identified as high risk for negative consequences and substance abuse. From this program, Shannon published a parent guide identifying protective measures to consider in the parenting of teens. Since entering the mental health field in 2008, Shannon worked in public relations and served as a patient access manager for an acute psychiatric hospital and an adult addiction treatment facility. Next, Shannon served as a treatment placement specialist for 6 years and currently serves as the National Accounts Manager, focusing on educating corporations and tribes about access care for teens, young adults, and families that are in crisis. In today's session, the manifestation of medical issues as a result of untreated trauma. In this presentation, Shannon will share some scientific data and examples through published studies showing the relationship of poor mental health to sometimes devastating medical conditions. Shannon will also explain the levels of care within the mental health field and examples of what level of care different challenges should we be referred into. Today's session is being recorded and will be on the Nahara YouTube channel this Friday. Please make sure that you utilize your chat box, ask questions, and share comments or any challenges or any success stories with Shannon and the group. Also, too, if you are a THERP certified professional, Barbara Griffin, our administrative manager, will be notified that you attended today's session and you would be rewarded credits through your THERP certification. With that being said, I believe we have President Wright on the call, and I just wanted to see if she wanted to say hello to us.
Good morning, everyone, or good afternoon, depending on where you are uh, located. I just wanted to thank you for coming to today's coffee talk. I'm actually very excited to hear the information that Shannon has to present to us today, and just knowing that mental wellness and mental health is such an important topic today. So I don't want to take too much of Shannon's time, but welcome everybody.
Great. Well, with that being said, Shannon, I'm going to share my screen and I will turn it over to you.
All right, thank you. Okay, thank you. Let's go ahead and go on to the next slide. We had a little technical difficulty, so Janet is going to kind of run the slides for me. So thank you everyone for taking the time out of your day to see this presentation. I'm really passionate about this because, as Janet mentioned, um, I have a history of trauma and addiction myself, and so kind of through my own journey, I discovered that many things that I experienced I didn't need to experience had I known the resources that are out there and how to get help. So I'm going to talk about some of the things I've discovered in my journey along the way, and experiences I've had with some of the kiddos that I've worked with and the families I've worked with, um, and just the tools I've found that I've picked as my favorite tools to reference and refer people to when they're kind of caught in that crisis cycle or working in the industry where you might encounter somebody that needs help. So I'm going to just kind of go over some different tools. Like some of you may be familiar with the ACE test, which is Adverse Childhood Experiences. It's one of my favorite tools, developed in the 90s by Kaiser Permanente. So I'll talk a bit about that, and then some trauma studies, some books that I highly recommend, and then also some of the things that I found in my the program that was mentioned, that I worked collaboratively with the police department and youth assistants in high school, in putting together about teen impressions around parents' acceptance of certain behaviors. And then we're going to talk about the importance of family engagement as part of the solution when a teen or young adult is in trauma or in crisis. And then also understanding the different levels of care. There are terms that people that don't work in the clinical environment that are assumed when you start to reach out for help, that can become very confusing. So I'm going to talk about the different levels of care and how you qualify for different levels of care, and how insurance relates to that, and then talk about how to find resources in your area. So let's go on to the next slide. Let's get started. So I think Janet gave a pretty good description of who I am. And one thing I have learned in my journey of long-term recovery is that the diseases that I have do not define me. They have certainly guided me in a journey along the way, and I've learned so much. And oddly enough, in different parts of my life, I've been grateful for the journey because of what I've learned from it. But I've learned not to let it define me. And I've learned a lot about recovery and how to help others that are caught in a crisis cycle. Before I got into mental health, the industry in 2008, I worked in the fields of human resources and then also technology. I'm really good at breaking things, and so in technology, that was my job, was breaking software, which I made a lot of enemies, but I made a few friends too. But when I attended the summit, the NAHARA summit, this past April, I had been talking with Janet a few times about the THERP certification, and trying to figure out, like, was it relevant to what I'm doing? It would have been relevant in my HR background, but then is it relevant to what I'm doing now? And during the summit, the two gentlemen from Drummond Woodsum actually presented what the THERP training is, and I think that I was so impressed with the two gentlemen that were presenting what it was, and how they bantered back and forth and how they presented for their hour, that I thought I could learn from these guys. And this, 3 days of training seems pretty intense and long, but because of how they presented just in that 1 hour, I thought I could listen to these guys for 3 days and learn something, and they could keep my attention. And so I did actually go to the THERP training in June, and it was amazing. So if it's something that you're considering, I really recommend it. I learned so much about sovereignty and how the state laws work or don't, and how federal laws work or how they don't. How there's like some silent things, and I learned so many things in that THRP training that I highly recommend it for anybody that's thinking about it. It was amazing. I did do the exam at the end that I was a little nervous about, but I did get a solid B. So, it wasn't an A, but it was a solid B. So I was really happy about that. So I do recommend that. Let's go ahead and go to the next slide. So just as far as Newport Healthcare, the company that I work for that actually pays me to educate people about access to care. I work on a national basis with some of the larger corporations, or what's considered or called a vertical market. So like tribal, for example, indigenous people, that is a vertical market because it spans the country versus just one company in one location in one state. So a lot of times with vertical markets, there are additional considerations or sometimes complications that have to be considered in order to get that population access to care. So that's what I specialize in, is kind of digging through the abyss of what can sometimes be considered barriers to access to care and figure out how to get people where they need to get to in order to get the care they deserve. And what we at Newport specifically specialize in is residential care for teenagers and young adults. So starting at age 12, teenagers or young adults that are struggling with mood disorder, or trauma, depression, anxiety. We see a lot of in this population: anxiety, suicide ideation, cutting, self-harm, some mood disorders, and also some substance use disorders. And I will say that in the years that I've been in mental health, I'm really seeing almost a shift, if you will, from where it used to seem that coping skill with trauma and depression, anxiety was marijuana, pot, or excuse me, marijuana, pot is saying marijuana, alcohol, mostly marijuana with the kids, with the younger generation. But then once access becomes available, it starts to shift over to alcohol. And then also drugs. We see a lot of drug addiction, really scary drugs that take lives. We're seeing a lot of that. But I'm seeing a bit of a shift from the addiction as a coping skill to other things like self-harm and suicide ideation, and just like social media addiction, and really, really strongly impacting their impression of self and their value of self, and just really even their willingness or ability to get out and have community with people. So it's creating a lot of that social anxiety. And that's what we specialize in with these teens and young adults, is kind of identifying your authentic self and finding that motivation to find your community, your support in your area, so that you can be your authentic self and not this social media person, or comparing yourself or trying to fit in some particular demographic that seems popular today. So we're really about who and what are you authentically, and how can we help you be the best authentic you that you can be, and thrive as an individual and a family. Okay, next slide. So the first question I wanted to kind of put a bookmark in your brain to think of as we move through these slides is, how much of an impact, if any, does a parent or guardian's mental health have on the mental health of their teen or young adult? So this actual analysis done by Wakefield Research, the scores came back as basically 96% saying at least a little. So a great deal was 63%, which is a pretty high number, but it's also not quite as high as I'd like to see, because the answer truly is, especially with generational trauma, it's a great deal. When we have a person in the household, an adult, an authority that is struggling with a mental health or trauma issue, it absolutely does affect the rest of the people in the household, even the dog. Okay, so it's really important that we recover as a family, not just look at who might be acting out in the most visual way, and say, well, little Johnny has a problem. Let's get little Johnny fixed. Because oftentimes what we find in working with the family is that there's generational trauma in there, and we all just kind of manifest that differently in our behaviors. Next slide, please. So this was one of the most powerful tools that was actually put together and then studied and surveyed and then published from 95 to 97 by Kaiser. And what's really important to point out about this particular study, which is the ACE test, which stands for Adverse Childhood Experiences, is showing the cause and effect of mental health issues on medical presentation or medical complications when not treated. So this was one of the things that they really point out here, is that the demographic of people that were part of this study were not any specific demographic. They were people that had benefits, they had access to care, they were not homeless. They some of that was in there, but it wasn't specifically. So what they found in the numbers I'm going to share with you in the next slides are that this is not something that is just specific to a poverty level or a person with resource level. This is a human level as far as how trauma affects our brains and bodies. Okay, next slide. So what this actually tests, I think we might have skipped a slide. Go back one. No, go forward one. Nope, forward one. Nope, keep, other way. No, other way. Okay, you're going back to the beginning. I need you to go the other way. Sorry about that. Okay, so people, go ahead. You were on, okay. I seem to be missing a slide in there, but people with a higher ACE scores actually have a higher probability of they're like a person with a score of 4 or higher is twice as likely to smoke, twice as likely to be diagnosed with cancer or heart disease, 7 times as likely to be an alcoholic, 6 times as likely to have had sex before the age of 15, 4 times as likely to suffer from emphysema or chronic bronchitis, which that was kind of the heart disease, the chronic bronchitis, the emphysema, 5 times as likely to experience depression. Those things were, I think, what really kind of jumped out at me, because I thought, well, these aren't behavior things, they're actual medical things. So how is it that a medical condition can be a result of something that wasn't a personal choice? So that's where I started to really think I need to have more information about how does this manifest. So for some reason, it seems like my 7th slide wasn't showing there. So I'm going to read to you what the 10 questions on the ACE test are. And for each question, give yourself or whoever you're maybe thinking about at the moment a 1 for each yes. So the 10 measures are, if this occurred before the age of 18, physical abuse, verbal abuse, sexual abuse, emotional neglect, physical neglect, having a parent who is an alcoholic or using drugs, having a mother or stepmother who is a victim of domestic violence, having a family member in prison, having a parent or parents with depression, or the parents were divorced. So a 1 for any one of those 2 things then gives you a score. So if you kept a score, keep that number in mind as we go over a couple of slides here. So for myself, I had at least a solid 4, if not as much as a 6. And it's kind of some of those things, it kind of depends on how you interpret it. I didn't have a a parent in prison, but I had a parent that was in jail several times. So, so there's like, maybe I had a 4.5, or was that a 5? Or so, it's relational to how you or the person perceives. But then that's what this particular slide dictates. This is part of what that dictates, is a score of 4 or higher was twice as likely to smoke, and so on. So I just really found that interesting, which is what triggered, a lot more research on my part. So let's go to the next slide. So what this and I actually have, if anybody's interested in seeing this whole, like, the ACE, kind of the intro, the 10 questions, and then the dialogue after it, I can send that to you. At the end, I'll have my email and phone number. If you want to just text me or email me, I can send it to you, or I can send it to Janet. She can send it out to whoever asked. But what's really interesting, and actually a real relief about this information, is that our epigenetics can change. They can reverse those predictors on that previous slide. So we can, through the environment and through proper treatment that is specific to the actual trauma, we can change the outcome, that manifestation, into heart disease or emphysema or breast cancer or the many other things that it can manifest into. But of great importance here is that without treatment, the life expectancy of an individual with an ACE score of 6 or higher goes down by as much as 20 years. And that's impactful. So, as personally, when I was reading this information in my studies, I just thought, well, so I don't want to talk about that stuff with a therapist. I want to keep that skeleton in the closet. It's not bothering me. It's like, it's not going to own me. All the things that we tell ourselves. But then when I'm thinking, why is it that I have very few memories of my childhood when I was sober, and I have more memories of my drinking years when I was intoxicated, and expecting or experiencing more trauma because of what I was exposing myself to under the influence. Why is it that my memories of when I was clean are seem somewhat erased? Well, the answer to that is there's a lack of trauma treatment, that there's something in those childhood experiences that needs attention in order to, I don't want to say unprotect my brain, but unprotect some of the good stuff I do need to remember by processing the bad things I'm blocking. So that's the importance of that from my personal experience and interpretation. And I've actually gone to, I don't know if you've ever heard of EMDR, but it's eye movement desensitization reprocessing. And I decided that I would actually get that treatment and see if that was something that could help me with those childhood memories. And I got partially through it, and then kind of switched over to an IFS, which is called Internal Family Systems, because my therapist found that I was kind of presenting one way, and then them preferring to work another way. So everybody's treatment is a little individualized to what your comfort level is as you uncover different things. But it is an amazing, amazing therapy to experience and realize how it connects certain things to certain things. And I'll tell the story on that a little bit later. But what we want to also focus on is that in the research, they're showing that the ACE scores and the poor health behaviors were not the only contributing factors to a predictably higher probability of disease. So we want to make sure that regardless of how much we think that maybe we're okay, we process that if it isn't truly processed, it can still kind of come back and get at you. So one thing that a doctor in the addiction hospital that I worked in said that has always resonated with me is that he said the genetics load the gun and the environment pulls the trigger. So that kind of relates to the epigenetic changes that are reversible, that if you are genetically loaded, I'm double genetically loaded from both sides of the family for addiction. So I almost didn't have a chance. Like once triggered, that was just inevitable for me. because I wasn't properly educated on maybe not starting to experiment with alcohol until maybe my brain was fully myelinated until like maybe age 23 or 24, then my chances would have been better not to have triggered that gene, so to speak. But without education, moreover, what I was seeing, my education was the way that I was raised. What I saw and what I witnessed is that to be an adult, you smoked cigarettes, you drank alcohol, you might even smoked a little bit of weed. So to a teenager that's an emerging adult, that is what defined an adult, right? I'm going to do what the adults do. And so we trigger this disease at an early age because we are genetically loaded, but also because our environment is showing us that that's how I become an adult. So, okay, let's go to the next slide. So this is the first book that I wanted to recommend. If anybody here has read this, show me a thumbs up or a comment in the chat box. But it's an amazing book that I recommend. I am an ADHD person, so reading a book is a little tougher for me to like keep the my attention. But I can listen to a book while I'm driving, and it really shortens the drive and like gets you involved in a story. And an amazing book, as Hanslin has said. Um, it's a very thick book. It's a very long book. But it really pivots between scientific data and researches that starts actually back in the 40s of a lot of the psych ward type patients and what these doctors were finding, and also much to this book will make you angry when you hear how they treated patients, what they did to patients, what they ignored, but then also it'll enlighten you on how they kind of use them in ways that really did help them resolve some issues so that they could move forward on how, what to do to actually help people get out of those mental health crises. There are certainly some people that can never recover, but there are a vast majority of people that can recover with the right treatment. But a lot of people back in the day, in the 40s, when you suspected that they were psychotic, you just put them in a sanitarium or institution, and that's where they died. And there was a lot of abuse there. So, Janet, somehow my screen went back to who we are. We were on the Body Keeps the Score. Okay, so this book actually, I highly recommend it. It also goes into very specific types of trauma. They tell the author tells a lot of stories about like he'll tell stories about perhaps a person that was in the Vietnam War and what they were exposed to and how their reactions were like when they heard loud noises like fireworks or things like that, how it would trigger them, how they would react, and then what types of therapy they applied to them. So EMDR is something that is a really, really common trauma therapy modality, but there are some profiles that it actually could be damaging to try EMDR on them. So what they found in this type of profile, like a veteran, was that one of the best therapies for them was to be in a group therapy with other veterans because they've experienced, especially combat veterans, they've experienced things that are not, they're not societally, if this word correct, it's not appropriate for them to talk about those kinds of experiences in the general population. And so what that does is it shuts them down to where they can't share their experiences because they'll traumatize other people. And then also they're afraid of being judged in a way that, for what they were doing for their country, they're now being judged in a very harsh manner for, what is a break of a law or a moral code was actually a requirement. There's a real twist in the brain that happens with that individual, and for them to be able to work with other veterans that experienced combat is actually, one of the best therapies for them. Whereas like an EMDR, to have them go back and experience that and reprocess that isn't necessarily the best thing for them to do. So an example of where, like from my personal experience with EMDR helping, is that I was, when I was working with a therapist, we were talking about my relationship with my daughter and her husband and my grandchildren, and then just, certain situations where I would kind of shut down, where I felt like, like maybe they didn't want my opinion, or the, anyway, I was like talking about how that made me feel, and I would just kind of withdraw, just be quiet, not be heard. And what she did with the EMDR is, at that point in just our talk therapy, said, I want you to hold on to just that feeling that, but like that you have right before you withdraw and kind of become invisible. And I want you to not focus on your daughter, but I want you to focus on that feeling. Like, do you feel that someplace in your body? When you just think about that feeling, do you feel that somewhere in your body? And I want you to like put your hand on that spot. And then she would, there's this like machine that does this dot that goes back and forth, and she would have me watch that for 1 minute, just thinking about the feeling. And what was amazing about it is that it was almost like a slideshow of different parts in my childhood and different people in my childhood, where I had that same feeling. And then that's kind of where the therapy started, to say, so let's talk about how you felt at that point and what you did, what was happening, and how you're projecting that into this completely different situation. And then she just really helped me give myself a voice now as an adult, because I can speak and I can represent for me, and I am important to this family, and my opinion matters, in how I present it. So it's just really an amazing book. So I highly recommend that. And they also, while the study started in the 40s, there's, how books will release and then there will be a second edition, third edition, and so on. The latest edition of this book actually does include where they continued their studies, and then they start looking at the ACE scores and tying it back to the research that they had. And it is absolutely relevant, into looking at the importance of not thinking that because somebody was only 2 when something happened, that they won't remember it anyway, so it won't affect them. It absolutely does, because as the story is titled, the body keeps the score. So the processing has to happen. So let's go ahead and go to the next slide. So this is my next favorite book. It's almost, it's the one I read the most recently, so I almost like it more than The Body Keeps the Score, but for different reasons. So The Body Keeps the Score is more scientific, and it's very deep and about a lot of different traumas, whereas The Deepest Well, written by Nadine Burke Harris, is she is a pediatrician. She was also the I believe first Surgeon General in California, and she's just an amazing woman. That's her in the bottom. And in this book, she's also very funny. I love the way that, I of course listen to this book too. So, and she does read the book herself. She is the person that is on the book that you download. But it she focuses primarily on children, and she kind of starts the book with a story about a young boy that mom brought in as a new patient for her. And this young boy was he was not on the correct trajectory for growth. And so they were trying to decide, like, is this malnutrition? What is his diet like? Like, what, and the mom had said that he was on the right trajectory until about the age of 3. And then he just didn't seem to be growing anymore. He was eating, she wasn't sure what was going on. So as she did the ACE score for him, obviously the 4-year-old can't answer for himself, but mom is doing the test for him. Mom shared that dad had lost his job when the child was 3, and that they had taken in a boarder, and this child was sexually molested. And of course, when they found out about this, they pressed charges. The man went to prison, but the trauma is there. And that coincidentally, is when this child's growth stops. So having that information gives this pediatrician the information that she needs in order to give him the right age appropriate treatment for this baby so that they can move on. But they also allowed her to give the right appropriate treatment to the parents to create the environment where this child can thrive. Because as you can imagine, something as devastating as that is going to affect your household. Okay. It's going to affect the relationship with the parents, how they communicate, how they bond. So all of that is a part of this little baby's recovery and getting him back on track. So I won't do a spoiler alert, but through the book, it's like she talks a little bit about this family and then shows more data and more stories, and comes back and talks a little bit more. And so it's a really great story. Another thing I found really interesting about this study is that she then teamed up with a doctor that specialized in bariatric surgery for obesity. So what they did is she then, they decided they would, all the patients that were in like the program currently or willing to for prior patients as well as new patients being evaluated for bariatric surgery took the ACE test. 100% of them had a score greater than 4. So that's amazing and really helpful in determining, perhaps something that should be addressed for obesity is that perhaps we need to start looking at not just the diet, of course, that needs to be worked on, nutrition, proper nutrition, but also the trauma. Is there something that person needs in order to reprocess and shift out what is hurting them, what is causing this obesity? So in her study, patients with 4 or more on their ACE scores were twice as likely to be overweight or obese, and 32.6 times as likely to have been diagnosed with a learning or a behavioral problem. So she also shares, you can actually go on YouTube and YouTube her name. She's got an amazing video. I've actually got the link right here in the presentation. She talks about how she had all these patients that were coming to her, or parents that were wanting their kids to be put on ADHD drugs, and long story short, found that their ACE scores indicated that there was something else they needed because of adversity in their families. So let's go ahead and go to the next slide. Okay, so this is something I wanted to share as far as kind of going back to my childhood and having you kind of put this question or evaluation in your household or the household you might be thinking of what is the level of approval for substance abuse or disapproval for substance abuse in the home, and look at how by the child's age, their impression of the approval rate or disapproval rate of their parents drops with their age. So they start to think, well, maybe my parents really wouldn't think it was a big deal if I used alcohol or marijuana or cigarettes. So you see how by the age that drops. I thought that was interesting. So that's a good thing to evaluate. Is like, what are you modeling in your home, and what are they learning from what you're modeling? I always challenged the parents in my court diversion program that if your kid is struggling with quitting the use of marijuana or whatever their drug of choice is, and you're smoking marijuana or cigarettes, I would like the two of you to partner up and have a buddy system in recovery to stop doing things that bring you harm. Let's go on to the next slide. Janet, can we go to the next slide? There we go. Okay, so levels of care. So this is a national thing. So this isn't just a Newport thing. This is like every company in the healthcare system. They are going to fit into one of these categories, and some of them fit into multiple categories. So with a large health system, they might have acute hospitalization for like suicide or homicidal thoughts or psychotic behaviors. But then we drop down into like the residential PHP, IOP, outpatient discharge. It's kind of like from the highest level of care to the lowest level of care, how that works. So with Newport, we're residential. So residential means that we have the patient in our care for 24 hours a day, 7 days a week, for an established length of time until they get through a program. And then once they are stabilized, they've completed the program, or unfortunately the insurance cuts them off, we then step them down to like a PHP, a partial hospitalization program. So the word hospitalization in that acronym is a bit misleading, because most PHPs are not affiliated with a hospital. But initially, when that was created, it was a step down in an acute psych hospital. But that is now something that is covered in a standalone establishment where they offer that level of care. And how it differs from residential is that it's like a day treatment program. And typically it's 5 days a week initially, for 6 to 8 hours a day. And as you go through the program and get better, and stabilize, it then might drop down to 4 days, 3 days, 2 days, and then you go to IOP, which is 5, 4, 3. So it just depends on the individual and the programming, and then also the support from the benefits program as to how much of that will be covered. And then you eventually get to just straight one-on-one outpatient treatment, and can even do like virtual care, which is becoming real popular, but not always effective with individuals. I really recommend that with a person that thrives with that community of being in person, please give them that privilege. If it works for them to be virtual, absolutely. It's a savings of money. You don't have to drive, you don't have to park. It brings access to care much easier, but it is not the end all be all for everyone. Some people just absolutely need that community of being in person. With our residential PHP levels of care, we also incorporate education into that. So they're required to be in school using their IEP or whatever from their school while they're in treatment, or if they've been kicked out of school and not welcome to come back, we enroll them into an online schooling while they're in our care. Okay, next slide. I know I'm speeding up here. Sorry about talking fast, but we're getting close to my 45 minutes here. So this is kind of like overlaying two slides on top of each other. I'm going to go to my presentation so I can kind of just see it better. I don't know if everybody else is seeing that okay, or if it's just like how mine is working. But what is most important in deciding what's the best treatment approach for your loved one is to find a program that uses family as the foundation. So it's important that when the family is a part of the treatment, that it's not just a matter of tell us about little Johnny, but it's in our treatment, we're going to be talking about with the parents, what was your childhood like? What was your relationship with your parents like? We're going to identify the traumas and the generational trauma that might be moving into the crisis that is happening with the whole family, really, not just little Johnny. So we use what's called attachment-based family therapy, and that's where, again, it's not just talk therapy with the family and the teen or young adult. It's therapy for the whole family that also has the family has their own group therapy sessions that they can do virtually if they can't do it in person. And they also have their own alumni group for support. And it's amazing how many of the alumni actually say, I felt so alone. Like I was just a bad parent, and well, how did I do this to my kid? What did I do? What can I do? And then when they get together with those other families that are experiencing very similar or same circumstances, they realize they're not alone. Just like the veteran, when they're with people of their own community that are having the same experiences, the healing can begin. So the family component is super important. Next slide. So yeah, I don't know what's going on here, Janet. It's laying over. But so our core beliefs, as I said, are that the clients are not the problem, and the family is the solution. And the behaviors are really just an underlying component of a mental health issue. So how we act out is indicative of something inside that is an internal conflict that needs to be addressed. So we want to make sure to involve that family. We also involve the academics because for the kids, especially after COVID, oftentimes the schooling is absolutely triggering. We had my favorite story was one young man that when he entered our program, his life goal was to turn 16 so that he could quit school because in his state that was the legal age where he could quit. Um, and by the time he discharged, he couldn't wait to go back to school so he could show his teachers how smart he was. So he just had some learning challenges there that were addressed in the private tutoring and schooling that he had while he was in our program. So it's really important that we address everything that is kind of a contributing factor to the mental health degradation of the individual. And also with our programs, we're like one of the highest staff to client ratios, meaning they're not like a group of 20 to 40 people being herded from one room to another to watch a video or you can't hide in our treatment. Our max clinical to client or like client to therapist ratio is 8. So most of our locations only take 6 clients at a time. So you're not hiding in that group regardless. So everybody we eventually get to that part of it's all about you. Um, it's amazing how many of the patients, they really struggle those first 2 weeks. It's the hardest time for the patients and for the parents because of that separation and the anxiety that comes with that. But after they get through those hard parts and they start to really see how they can have a community that understands them and helps them, and they actually start to work on things that cause breakthroughs and shifts for them. They understand that healing is possible. A lot of the patients that we get are a higher acuity and they've experienced so much trauma upon trauma that they don't think that they can get better. So we have to get through that belief because if you believe it, it's true. So I'm going to say that again. If you believe it, it's true. We have to change their belief. And that takes a little bit of time. And that takes a family to kind of really embrace it. And sometimes they hold on to that tighter than you would ever think somebody would, but it's all they know. And so that's what they're most comfortable with in spite of how horrible, horrific, or uncomfortable it is. It's what they know. So it's what they hold on to. We got to break those grips. And we do that through a lot of different integrative therapies like equine therapy, mixed martial arts, Kaigon, yoga, hiking, outdoor adventures, things like that. Different people heal differently, so they're going to get a lot of different experiential type of treatment in order to see where we can find that shift. Okay, next slide. Just basically, as far as Newport, we are all across the country. We have over 80 locations, and we have what's called clinical outreach specialists across the country that their job is to connect with all the local resources so that we know what the resources are when people discharge from our programs, where they can admit for continuing care for family therapy, for trauma therapy, for equine therapy, or whatever is on their continuing care plan. They have to have partners in the area of where that client lives and that works with their insurance so that we can continue what we started. And that's very important. Residential care is of little value. It's a great experience, but it's of little value if it doesn't have continuing care when that person steps out of that controlled environment for that 24/7. So what I like to do is participate in wellness fairs. If you have a wellness fair, I love to be there. I love to present. I presented at I presented at ALCO's Missing and Murdered Women and Children conference last April, and it was just amazing. I did compassion fatigue, and then I also did trauma. And I'm going to be doing one for the Chehalis conference in September. So really excited to do those kind of things and just educate people about things you just don't know and resources that you have access to and our outcome studies using the method that we use so that you can actually have a happily ever after for the family. That's the goal. Next slide. This is my contact information. I'm going to give you my cell phone number because, again, I'm still getting like a double overlay. My telephone number is 810-310-2143. I'm going to put that in the chat also with my email address. You're welcome to reach out to me if you'd like to get a copy of this presentation. I can email that to you or call me if you have somebody you want to talk about that needs help. I'm here for you. So thank you again for your time. And does anybody have any questions? You guys have been real quiet in the chat here.
Shannon,
Yes.
thank you so much for that information. It is, gosh, every time I talk to you, it's just so needed. Now, if I am working for an organization, how does one go about and looking at programs that I have right now for mental wellness? Would your organization be able to come in if I reach out to you to look at what we currently have in our property right now and maybe give us some recommendations?
Yeah, I would absolutely be able to like kind of do an evaluation and some recommendation. And another thing that we are working on right now with our prairie care locations in Minnesota, we have uh, Dr. Blackfoot that is working with us on some. It's a tribal toolkit to educate culturally all of our locations so that when we have an indigenous person come into our treatment that we have the cultural sensitivity to that, but then also with all of our locations we want to partner with like a tribal partner in that area, because as we look at how to roll out this training to our locations, we would like it to be delivered by a member in that area, because what we're finding, and you've told me this, if I were to ask 5 different chiefs or executives a question, I will get 5 different answers. So it really differs by the area, the indigenous area, the tribe, the affiliation, if it's on res, if it's off res. So it's really important that as we look at our own internal training for our staff, that we make sure that it's relevant to that immediate area that's being served.
Excellent. Wonderful. And just to let everyone know, the session is being recorded. So if you wanted to go back and watch the presentation, it will be up on the Nahara YouTube channel by Friday. Now, Shannon, if I were to reach out to you, would you be able to share your presentation
Yes,
with our attendees? Awesome.
absolutely.
Wonderful. And you will be at the conference this year?
Yes, I will. Yes, I will. I actually have got an exhibit at the conference. So if anybody wants to talk with me or schedule an appointment while we're there, I'm in. I'm excited
Awesome.
about it. I've been watching
Excellent.
your LinkedIn and all the topics and thinking, okay, I'm like gotta pick out what ones I want to attend.
Excellent. Well, Shannon, thank you so much for your presentation. Always good. We are very, at Nahara, we're grateful for your support and your organization's support. And for those who haven't signed up for our Nahara conference this coming September, we are almost sold out. We have just minimal registration availability left. So make sure that you register so you can meet Shannon and her team. We'll have about over 48 sessions at the annual conference. So please visit us at www.nnahra.org. Shannon, thank you so much. It's always a pleasure speaking to you. And we look forward to seeing you in September. And to everyone who visited us today, thank you so much for your time. And once again, the video will be posted on Friday on our YouTube channel. Thank you, everyone, and have a
Thank
fabulous
you.
day.
Take care.